Hello and welcome to the lower arm video. We're going to be talking about the muscles of the lower arm and the hand. So the first thing we're going to do is we're going to address the forearm. Now, the forearm has a lot of different muscles. There's a lot of muscles, there's a lot of layers. And what I want you guys to kind of note is that almost all of the muscles on the anterior side of the forearm are going to do flexion of the forearm, and almost all of the ones on the posterior side, or not forearm, it's going to do flexion of the wrist, and almost all of the ones on the posterior side of the forearm are going to do extension of the wrist. So the way I remember it is on the anterior side, they do flexion and they attach at the medial epicondyle up here. So that's A for anterior, M for medial epicondyle, and F for friend. So that's aloha, my friend. Think about when you wave to someone to say hello, aloha, my friend. A friend of one of my teachers gave that one to me. So anterior, medial, friend, and then I think of flexion, F, and golfer's elbow. So when we're talking about golfer's elbow, we're actually talking about medial epicondyle, or medial epicondylitis, so inflammation of that medial epicondyle. So if somebody says, "Oh, I have golfer's elbow," working this muscle group on the anterior side is really, really beneficial. On the flip side, literally, posterior, we have posterior, they mostly attach to the lateral epicondyle up here, and then they do extension. So PLE, and I have please leave everyone. It's the exact opposite of everything the other one says. Aloha, my friend, hello, please leave everyone, get out of my face, right? So posterior, lateral epicondyle, extension of the wrist, and also I think of tennis elbow. So T in tennis, E in elbow. So tennis elbow is going to go to the posterior side, where golfer's elbow is flexion on that medial side. Kind of a quick way to kind of remember that. So if somebody comes in and says, "Oh, I have this condition or this condition," you can kind of remember them. All right, so I'm just going to start adding layers. Some of these muscles are important, but most of them are going to do the exact same thing, but I want you to see them. So right here we have, these are going to be the flexor, digitorum, profundus. So profundus just means deep. So if something's really profound, it just means that it's deep. So it's a deeper muscle, as opposed to superficialis, which is going to be superficial. If you look at the name, it tells you exactly what it does. Flexor digitorum, it flexes the digits. Profundus, deep. Then we have this muscle here. Let's click on it. This is going to be the flexor pollicis longus muscle. So flexor, it flexes. Pollicis is going to be the thumb. So pollicis is thumb. So anything that has to do with pollicis, or the thumb is going to say pollicis in the name, pollicis in the name. I can't speak. So these two muscles here, and if we go along to the back, we have this muscle, extensor carpi radialis brevis. So extensor is extends, carpi, the wrist, radialis on the radial side. So on that thumb side, it attaches actually down here to the wrist, and it's brevis means short, so like abbreviate, short. So extensor carpi radialis brevis. If we have a profundus, we have a superficialis, generally speaking. If we have a brevis, we have a longus. So you'll see a couple of those kind of mixed in. Some of these deeper muscles, let's see if I can get it to click on it. Thank you very much. This is a supinator muscle. Now our supinator, actually I could take off one layer and we could still see the supinator. Supinator is going to help to supinate the arm. So if you are doing a lot of underbody work, this muscle tends to get really, really stressed, and it feels really good when we grab it and start working on it. So, all right. And then there's one here. This muscle here, this is going to be extensor pollicis brevis muscle. This is going to help to extend your thumb. So like when you're hitchhiking or you're using your thumb too much, you can actually strain this muscle here. Or you can get tennocenovitis, which is, if you see this tendon sheath here, and then the one right next to it, these are the ones that go down to the pollicis muscles. And these muscles are the ones that really get affected when you have tennocenovitis. Tennocenovitis is just inflammation of these tendon sheaths that surround the pollicis muscles. Can be very detrimental to a therapist, but also learning how to work on that as a massage therapist for others is really beneficial. It's not real comfortable, but it's amazing the work that can be done for it. All right, so we're going to click off of that. We're going to move this back around and we're going to add on another layer. So you can see we can start adding on some more of these layers. This side attaches, like this one attaches up here. This is Extensor Carpi Radialis Longus. So same thing as the Brevis, only longer muscle. This is a Flexor Carpi Radialis muscle. This is going to be a flexion of the wrist at on the radial side. Let's see, do we have any on the posterior side? We didn't really add any on the posterior side except like the Polycast longus. So abductor Polycast longus, like I said, we had another one that goes through that tendon sheath here. Again, these muscles, anytime you have injury to the thumb, these muscles can be affected. So you, really getting in there when you have a massage therapist on your table is fantastic. This one, Extensor Polycast longus. So we have the brevis here, we have the longus here, we have the abductor, which brings the thumb apart here. Some people, you can see these in. You get this little area on your hand that pokes out. My hands are too fat for that, so I can't really like take a picture and show you. But you get like a little indentation. You can feel it if you feel right here at the wrist. You can feel these muscles if you pull your thumb, try to pull your thumb back as far as it can go and out as far as it can go. You can feel that little dip. Side note, that used to be called the Anatomical Snuff Box because what people would do in the olden days, I don't know if they still do it today and I don't care, but what they used to do when cocaine was very fashionable, they would sprinkle a little bit of cocaine there and sniff it. So I don't know how prominent that is now, and I don't care. But I think that's just kind of fun. Like, that was like French Revolution time back when, you know, like, it was a medicine. Okay, stop. I want to click off of it. Okay. Program. Do what I tell you to. Okay, so moving on. We're going to add in some more layers. So we get some more. So right here we have the Flexor Carpi Radialis muscle. So this is going to be flexing the digits. On that side, we have the Flexor Digitorum Superficialis. So there's one that we missed in there. That was the Profundus. Maybe we saw the Profundus. I don't remember. It's only been 8 minutes. So this is going to help to flex the hand. So all of the flexors are on this side, and it goes all the way down. You can kind of see how it works. So it goes through this tendon sheath here and then goes down all the way through. And if I isolate this muscle, you can see that it goes all the way through, down through the phalanges. So all the way down there. This muscle, the muscles that do flexion and extension of the hand can get very, very tight. Now, these are all tendons, so it's not muscles in the hand. So if their hand is getting so tight that they can't really grip a whole lot, this muscle is the one that you really want to start to try to focus on and work on. All right, so we're going to add in one more, and then we'll look at the hand. Yeah, this one right here. This one, Brachioradialis. This goes all the way down. I'm going to isolate this one so you can kind of see where it goes. It goes all the way from above the elbow all the way down to that styloid process of the radius. So this is going to help flexion of the elbow. So this is going to be the one that when you reach onto your forearm, right on the part, like right on that, the hairy part of your arm, this is that muscle that you're going to be able to really feel, especially if you start flexing your elbow, you'll be able to start to feel this pop out a little bit. And this one, the supinator, is just underneath it. These muscles are very important for us as massage therapists, especially when we do a lot of underbody work, because we tend to flex and we have that isometric contraction when we're doing that upper body work. So you want to really make sure, if you have a massage therapist on your table, or if you're getting worked on or whatever, that you start to say, I want some extra love and attention to these muscles here. All right, and then we're going to maybe click off. There you go. I don't think it did. All right, so we're going to come down here to the hand really fast and try to do some hand muscles so we can kind of see. Now, the hand muscles, we're going to start here. I just want you to see how these muscles kind of look. You don't really have to know they're interosseous muscles. You have your hypothenar muscles over here on the pinky side, abductor digiti minimi. So that's the hypothenars is a muscle group. The thenars are on the thumb side. We're going to see some of those as we add those in. I just want you to see the layers and how many muscles we do have in our hand, and why working in between those metacarpals and working on the fingers really does feel good and is beneficial for our clients as well as us. The more they use their fingers, the more we're going to want to work on these areas. So we can start to see the thenars start popping up. Now this muscle here, I'm going to point this one out here. This one here is called the Palmaris Longus. Not everybody has it. It comes from way up here. Sorry. I'm trying to move it. I keep clicking on the wrong dang buttons. Okay. I want the Palmaris Longus. So the Palmaris Longus, Palmaris actually comes in and forms a fan. If you have it, it forms a fan over the palm of the hand, which will help to all of your fingers do opposition. So bring your fingers together like you're picking something up with all of your fingers. I don't know why it's not shown on here, but it does do that. I've actually seen one like on a cadaver. So we do actually have one, but not everybody does. It's something like 45% of the population or something. I think that's the number. I might be wrong, but you can kind of look at that. All right, and then we're going to, that's all the muscles. So we have our thenars here. You see how many muscles of that thumb we have? Like lots of muscles of the thumb. They're pretty big, pretty thick muscles. So we have our thenars here, our hypothenars here, all of these muscles in between. So that is, those are the muscles of the upper limb. We've completed the upper limb. Stick around. We're going to do one more video. We have one video. We're going to look at the nerves. We're going to look at nerves, blood vessels, and I'm going to give you some bonus content and some bonus muscles. So stick around and we'll see you guys then.